Hi,
Hey, how you doing?
welcome to our hi, Dr. Rizwan. Thank you for joining us.
You're welcome. It's great to have me. Great to be seeing you again and speaking to you again after such a long time.
Yes, the last time I saw you actually was at the event we'd hosted David G, the meditation teacher.
That's right. Yeah, that was great. Great to experience and see your work.
Thank you. So just as an introduction, this is a series of interviews that I'm going to be hosting this week. So from the very first moment I understood alternative health as a practice of medicine, that it's not considered conventional, I knew for me it ran very, very deep. I feel it's really deep in my DNA. And I started training in Ayurveda in 2002. And over the years that I've practiced Ayurveda, many realizations have actually come through my practice and also through the teaching. So when you think that I started studying 18 years ago, people couldn't even say the word Ayurveda. So, now I'm able to use that knowledge that I've learned over the years to, through the system, to really help the people that I work with find vibrant health. So this week, we're actually going to be learning from some of the UK's leading voices in alternative health. And I just wanted to say that there is a paradigm shift that's going on at the moment in healthcare today. So alternative medicine is also being referred to as integrative medicine, or IM, you may also see, and this refers to the field of medicine that integrates the two fields of thinking. Today we're meeting with Dr. Rizwan Suleman, and he's the founder of the ICAHT clinic in Leicestershire. He's a chiropractor and a world-class hijama expert. And I just wanted to outline a few other things about Dr. Rizwan. So really what I've seen is your purpose is very much to enlighten people on the benefits of health optimization through natural practices, to empower people with natural and cost-effective solutions to support their health. You teach nationally. I know you run courses from your own clinic and also internationally. You've empowered thousands of students with the knowledge. I can't wait to hear more about this, the background. And also you do work with elite athletes. So this includes world heavyweight boxing champions, Premier League football players, and international athletes. So looking forward to hearing more about that as well. But really just to start, what experience led you to working with as a chiropractor and with hijama therapy?
Well, I think what you said there really really hit the nail on the head when you said that you saw Ayurveda as a medical practice, and then kind of you kind of caveated that and you said, well, even though it's not seen as conventional. And I think that's a really important point, because growing up, I come from a background where my grandmother was kind of a village healer, if you want to say. She was kind of a midwife. She used to practice herbal medicine and so forth. And that went forward to my mother. My mother used to run her own clinics and she used to have her own practices. And then later on, she went into nursing and she kind of left that behind. After my well, during that time, actually, when she was more in the kind of medicalized or the kind of conventional practices of medicine, she really had a strong push for me to say, okay, you know what, go into these fields in terms of health and medicine. And it was something I really aspired to, something I was really interested in, and something I was doing, moving towards in terms of my educational journey. It was only up until my time during sixth form when I came across part of our application for medical school and so forth was something where we needed to, put forward, evidences showing that we've done extracurricular work. We've looked out and we've had experiences and so forth. And my sixth form science teacher, my biology teacher, she actually brought in someone to talk on naturopathy. And the individual who was explaining, and she was talking about homeopathy, she was talking about a few different concepts, which were all completely new to me. But what she highlighted at that point was the fact that the medical systems that we use today are governed by a capitalistic kind of process, where if something is going to generate profits, then it will then be trialed, it will be tested, and that will enter the the scientific process. If it doesn't hold that credit, okay, that it isn't something that can be capitalized on, and you know, that shareholders can't make huge amounts of money from, then it's not even going to be looked at. Which really spun it got me dazed, because it just ripped the carpet from under my feet. And I was like, well, hang on a sec, you know, if my intention is out there because I genuinely want to help people, then how can I be helping people with a caveat which says I'm only going to help them with things that benefit, you know, shareholders and profits and all of these different things? And I realized from the short speech she gave, you know, and she was very inspirational, that, you know, the foundations of my medical knowledge and understanding and training that I was going to sign up to was heavily influenced by a pharmaceutical arm. And, you know, even the curriculum of medicine, for example, just the fact that it was void of nutritional studies, and there was no concept of, there was no basic even introduction to nutrition for medical doctors. This helped me realize that, hang on a sec, this isn't, you know, if we go back to the root. And you know, I'm always talking about our understanding, our philosophies, and understanding the root, meaning of things, right? So, what is the root meaning of medicine itself, right? What is, you know, the word? It's been, you know, we can say that it's been kind of monopolized at the moment, or it's been, you know, we've been indoctrinated into having a particular understanding that medicine is, you know, a white coat, drugs, surgery, and that's pretty much it. However, the reality of medicine, from, you know, our ancestral histories, from, civilizations in the past, has never ever been aligned with what we currently understand it to be today. So that's what set me off, and it was like, hang on a sec, I can't pursue this direction, and I have to look, further afield. And then I started to shadow chiropractors. I started to look into other practices, other disciplines, and my mind really got opened to realize that, you know, the concept of evidence-based medicine, and even what I was taught, you know, at a young age in school, you know, the scientific method, choose your variable, and all of this, it was built upon a fallacy that truth was the thing that we were seeking. You know, the reality is that profits are what we're seeking, and truth is you know, just a small part of that. You know, I'm only going to selectively choose truths which benefit me. You know, and that was that was a shock to my system, and that's what inspired me to make a big change in my direction.
I just wanted to say, you know, when listening to you speak, it's that you displayed a huge level of awareness at a really young age. Now, I say that because I have other friends who have qualified as GPs, medical GPs, following the Western system, and then come out of that system, you know, at that point, after their 7 years of training, to retrain in more lifestyle medicine systems, so things like functional medicine. So something in you triggered something very, very strong, you know, this, whether it's this sense of your truth, you knowing deep down that ultimately your mission is to contribute to the lives of others, and you needed to really find that system and that platform to enable yourself to do that. So what do you think it was?
To be honest, I came from a very mixed background. My parents are both from Kenya. They were born in Africa. And originally, on my father's side, they had many, many generations in Africa. So there's a very strong East African root there. And on my mum's side, you know, her mum was actually born in India and had come across to Africa kind of much later on in terms of the generation gap. You know, I had a little bit of a challenging upbringing. My parents separated when I was quite young. There was a lot of different things that went on. I ended up with my mum and my stepfather, who's English, and, you know, again, grew up in a different paradigm, grew up in a different way of thinking, even kind of on a religious, on a spiritual level. I wasn't really awake until, you know, you come to the age of around 13 or 14 when you look to start gaining identity. And I believe that there was an element of finding myself around that age, where I came across spirituality, I came across religion, and I chose the faith of Islam. And for me, that was, you know, it was a system that made sense. And from that age, I became very conscious of, you know, my family at that point weren't really following any religion or anything in that way. And you know, there was, in my house, there would be, you know, things which I would say that didn't really resonate with me in terms of even dietary things, even kind of alcohol, intoxicants, different things. And at that point, I became conscious of what I'm consuming. And, you know, in the philosophy and the spiritual aspect, what you're consuming has an energy. And if that energy comes from something which was negative, so if you're taking money which was, which isn't rightfully yours, and then you're buying food with it, you might as well be eating poison, because that will have an effect on you somewhere down the line. So this belief system made me think about what my path was going to be. And what you just described, where GPs are kind of 7 years into practice and they come to that realization, that was my fear. That was my fear, that if I'm going into this with the right intentions, and then I find out after investing so much of my time and my life into something which is, effectively, which is flawed on many, many levels, then I would be, that would be so devastating for me to be in that situation. And I don't know what it is that made me at that young age. Maybe it was some of the experiences and some of the traumas that I went through, and obviously everything happens for a reason, but maybe it was some of that was making me think ahead and giving me that kind of foresight in the way that, to be honest, I'm at home now. I have 5 children. I have a family. We have, there's lots of things that I've achieved. And to be 100% honest, I knew at that time that this was going to be. And it's not just in terms of where my practice went. I knew at that time, and I have journals and things that I wrote, and I was like, well, that was something which I wanted to happen, and it manifested. So at that age, I don't know what it was that inspired me, whether it was, some energy which I came across, or, even the I say the coming across that lady, and nothing happens for no reason, right? Everything has a purpose and an intention, and there's reason behind everything. And even that realization at that age was, I think it was very, very inspiring for me. And yeah. And I think a big part of that was the passions that people have when they, when someone's speaking the truth, they have a look in their eye, and they have a certain passion which, you cannot replicate unless, you are like, some Oscar winning actor, right? But, you generally, if that's genuine, you feel that, you feel that not on a mental level, but you feel it on a spiritual level, and you connect.
You physically feel it. And I mean, we talk a lot about this also, in Ayurveda, and certainly I've also, trained, qualified as a meditation teacher, and we go very much into the different states of, we're talking about different states of consciousness, and actually how we're able to self-realize into places where, we our approach is from the heart center, and that energy is manifested. We hear it in the voice, we see it in the eyes, we see it in the skin. It's, this isn't something that you can just put on for the day or for the session. Now, you chose to train as a chiropractor, and also you're an expert, a world-class expert in hijama therapy. So what do these approaches offer over and above other modalities? So I think there's 2 questions there. Why this path? And then what do they offer above other modalities?
Okay, so when we look at modalities, I think what I would say is that these are tools. Okay, so these are, these are kind of things in the toolbox that we can utilize. What is more important is the philosophy and the ideology that we're coming from, right? So, you can have all the tools, but if you don't have the right understanding, then it's useless. You can have all the tools to fix a car, but if you don't have an understanding of the car and the true essence of what a car is and what the purpose of a car is, you think you're going to be fixing it, without fully understanding what you're dealing with. So I think the first thing, comes to point. To be honest, in the beginning, it was a little bit like, okay, chiropractic comes from, and there was a chiropractic school not far from where I was. I grew up in Cardiff, and we had the Welsh Institute of Chiropractic, which wasn't too far away. So I thought, okay, well, hang on a sec, and in a way, the question was, okay, can you be here? Can you study here? And my mother was like, well, will you still be a doctor? I was like, well, yeah, I'll be a doctor of chiropractic medicine. So it's like, okay, tick that box then. Okay, so that was that. With all honesty and truth, I think that was part of the process. But ultimately, what aligned with me is the fact that they resonated from a vitalistic approach which on the onset, and when I first came into it, I saw as something which was, it wasn't flawed in the way that I saw the medical system. However, going into that and realizing that, I also saw a certain dogma within that practice, which I think is remnant amongst a lot of different practices, where there's almost a sense of elitism within that practice and that profession, and they feel like almost that this is the only thing that can help people. And because I have, a hammer, everyone I come across is a nail, right? And this is what we do, and this is how we work. So I went through that process, and I'm eternally grateful for what I learned and the knowledge that I had gained from there. I think that was the real turning point in terms of empowerment and understanding and knowledge. And actually, that's when I really had the taste of enjoying studying, and I had a passion where I'd never ever had that growing up. I'd never had that relationship with education that I had when I started studying the human body. So there was that initial aspect of it. But then coming to light after graduating and after coming through that, there were certain kind of dogmas, or well, I would say not dogmas, I say expectations of, you're a chiropractor, so this is what you do. And I didn't fit within those constraints, because my approach was like, okay, I've learned these tools, I've learned these skills, but what you're saying contradicts what my grandmother used to do. When I used to have a stomachache, I used to go to her house, and she used to do certain things for me, she used to make certain things for me, she used to rub my tummy, she used to talk to me in a certain way, and I'd feel so much better. And that doesn't align with what I'm being taught. Now what I'm being taught is, okay, well, this is this is what it is. And there was also a mismatch as well between the chiropractic and the model of chiropractic that I was being taught here and other models, for example, in America and other places, which I think were more resonating with a wider picture and were more aligned with traditional ideas and philosophies. Whereas we're now living in an era where even the alternative professions are sometimes being indoctrinated and influenced by outside hands, which are making us, there's a lot of complexes within chiropractors and people who graduate as chiropractors thinking that, almost in the sense that they feel that they are a sub-discipline that needs to work underneath consultants and underneath, the medical profession, and needs to adhere to the standards and the principles which they set. So, there was a long, obviously there was a journey, but ultimately through that, I learned that, I realized that I wanted to help patients. I started seeing patients, and very early on in my career, there's some long stories which I could go into, but yeah, I came across, a certain, I'll tell you the story. Okay. When I first graduated, I had no patience, right? And I was like, okay, I'm out there, I want to help people, and I'm going to use my hands, and I'm going to treat people, and all of these different things. And I was like, okay, well, and I got a room in a multidisciplinary clinic, and I was like, okay, so I've got overheads, and I need to see patients, I want to benefit people, and all of these different things. And I was sat there probably for a number of weeks. I saw a few people within my communities and so forth. And at that time, there was something, it was the first time, Groupon and Living Social and all of these things came out, right? And they were offering all these different things like experiences and all these different things they were offering, 50% off at restaurants and all this. And I approached them with the idea. I was like, well, would you consider doing chiropractic? Because I saw them offering massages and, spa treatments at discounted rates. And I was like, and actually they said no initially. And then I saw that, their head office is based in America or wherever it was, they did, deals, or they did offers with chiropractors. And I said, you turned me down saying that you don't offer this for medical services or chiropractors or anything else. I said, but, I think you should. So we went ahead with it. And there was no cap on it. Okay. So it was like, we just put it out there and we said, okay, well, let's see how many people buy this voucher. Yeah. And it just went boom. And like literally overnight, I think there was like 1,800 people that bought a voucher to see me. And obviously there's like an expiration duration within that. So I was like, wow, like I'm kind of now in a situation where I have a huge amount of people that I need to see. And, I'm new in the game. And what that did is it gave me a huge amount of experience very, very early on. And I was extremely stressed, and I was like, how am I going to deal with that? And I had the pressures of trying to give the best that I could give. But what I realized is that there was limitations that what I had to offer, and people's needs didn't match my abilities. And that some cases of patients that I was working with, they were able to see that I was, genuine in my desire to try and help them, but my approaches weren't always working. And, I often when we graduate and we complete our courses, we think, yeah, that's it, I can go out and cure the world. But, you learn more from your patients than you learn in university. So, I was learning, quickly. I actually had a very high number of, I saw a very high volume of patients. Again, not in the sense of, how some practices work where they will see patients for a short amount of time and that's it. No, I literally dedicated at least, an hour and a half to each patient, understanding them, trying to get there. And, we were taught in university as well that when you take a patient on, don't just ask about their current state, learn about their past history, because you can learn about their illnesses and their conditions and all of these different things. So don't just ask what conditions did you have in the past. Ask, how did they manifest? How did you get better from that? What did you use? And you learn through that process as well. So I was very much out there to learn and, open to receiving. And that process helped me realize that, I need to introduce more to this than just what I'm doing. Then that led me to go on to, introduce the concept of cupping and hijama therapy, which is something which is rooted within many different cultures, including Arab culture, something that was familiar with, my parents were familiar with from even Africa. And I started utilizing that and integrating that as something very new. And that was a really powerful tool, and it was something which I found has benefited people a lot. But again, it's not, the end all and be all. I started looking at nutritional therapy. I do, and go into mind coaching and helping people understand health properly, so that their foundations of health are correct, so that their behaviors change. So many different aspects, be it cleanses, be it colon hydrotherapy, be it, massage, be it, acupuncture, all of this stuff I started to put into my array. And I disattached myself from the terminology of being a chiropractor. And I said, no, I'm not a chiropractor, because, the connotations associated with that in people's minds limit me. And if I hold that in my mind, a lot of people are chained by their identity, right? My identity is I'm here to help mankind. That is my intention. They say that, the service of man is the rent that we pay to God, right? So, I'm here to try and help people. And I know that if I do that in the right way, that value will return back to me. And, I'm just continuously on a journey to try and do that more and more.
So Dr. Rizwan, as a practitioner, it's fascinating, because actually, as you talk us through that journey, it's very similar to the way I work in Ayurveda. Ayurveda as a whole health system, we have a number of different tools. So it's great. It's almost like you've gone on this incredible journey, and you've pieced all the bits together that are relevant for your patients, for your clients. And you've moving away from the titles, brings you back into that true essence of being a healer, I would say, and being a facilitator to support your patients in that way, without the conditioning that goes with a lot of the ways that, maybe when we're training, these labels are there. But as a practitioner, so you are well versed, you have been in the business, I think, for over 20 years.
No, 11 years in practice.
11 years in practice. And then prior to that, obviously, you were going through training.
Yeah.
So as a practitioner, what would you say you do in the field that others don't? I mean, you've already shared so much. Maybe you could just, sum it up in a few words.
I would say that I think the first thing is helping people gain the right understanding, first of all, of their health. The second thing is empowering them, right? And that is the essence of what I do. I can't heal anyone. I can't cure anyone, and I have no abilities to. And anyone who really and truly understands the human body and understands health and medicine will agree with me that we don't heal. Okay, we facilitate, and we help people, come to the realization of the powers that they have and which they hold within, and we unlock the potential of their bodies and their abilities to be healthy. And we all possess that. Every single one of us on this planet possesses the ability to be healthy. The only challenge is that we are blocking our we're restricting ourselves in so many ways. We're like a seed. If we give it the right things, then we'll grow. We will all grow. But we are not, there's so many things in our environments, in our lives, in our minds, in our choices, which actually prevent us from being healthy. So it's just unlocking and just kind of opening up the ability for that to happen. So I would say that overall, and the overriding thing I would say is that the approach, and then secondly, we do use a diversified technique where we use a lot of different, you have a lot more options. You go to your GP, you go to an acupuncturist, you go to a chiropractor, you may be limited in your choices. With what we do, if we don't do it, then we'll send you to somewhere that does. And that's the approach. It's about giving a tailor-made approach to you to help you achieve what you need.
And are there conditions that you're particularly good at treating? What do you see a lot of?
Well, I would say that, from my background in my training, my expertise is in musculoskeletal medicine, working with the spine, working with the nervous system by extension of that, and having a good founding understanding of that. And obviously, the nervous system is the overriding system that empowers and controls everything. So when you have the keys to that, now you have the keys to gut health. Now you have the keys to inflammatory conditions. Now you have the keys to so many different things. If you're able to work with that system and kind of influence it in the right ways. So I would say that it is quite broad. However, I'm not someone who would say that, I can cure anything and everything. What I would say that a lot of problems that we have today root with the nervous system, and they root with the master system that works with us. However, my forte from the beginning has always been kind of in musculoskeletal medicine, in working with the spine, with spinal health, and I would probably say the two areas is, musculoskeletal health and then mindset. I think those are the two things which I would say that we work with in the biggest way. And this is where, working with athletes has been really crucial, because I think often we assume that they have access to the best, and often is very, very far from it. And then secondly, a lot of the times, again, we think they have access to all the experts, which are going to help them with their mindset and things like that. But often these people are very lonely people, and they don't have, the support and the ability to have, an influence and a guide to help them with their mindset and all of these aspects, which are some of the things that we've gone out, the needs that we've gone out to meet.
Yeah, I wanted to stay with that idea mindset for a little bit longer. So would you say the kind of work that you facilitate can be generally used to improve life and also prepare for a better future? The reason I ask that is, with my work, I see many people who are wanting to learn certain tools and techniques for their own self-development. There's no visible ailment. It's more to, in a sense of actually growth, and actually being able to move forward. So tell me about that. Tell me about that with your work. So preparing for a better future, improving life.
100%. I think, what happens is I actually start working with people often when they are in a state of need, when they have a problem. That's when, the alarm bells ring for them and they realize, okay, I need to do something. When we start with them, we help them, and we help them unlock those aspects and come out of those conditions. And then a lot of that, again, is in relation to mindset and, their understandings and approaches. And then when we move on from that, you have to look at what is the purpose of health, right? Ultimately, why do we want health in the first place? The reason why we want health is because health is the foundation for us to build our dreams upon. They say that everyone has a wish, right? But a sick person, everyone has, wishes and dreams, yet a sick person only has one, right? And that is to be healthy. So now if we go to, the purpose of having health, and again, I always try and root it all the way back to the root. And it's, okay, well, the purpose of having health is so that you can, so you can achieve. The purpose of my health is to contribute, is to be there for my family, is to live the potential that I have within my life. Now, there's no point in having great health and looking at yourself in the mirror and admiring yourself and doing nothing with it. You're wasting it, right? If you're not utilizing it. And part of maintaining health is using it in the right ways, right? And utilizing it in the right ways. If you're doing the wrong things with it, then you end up having, a demise of it. Just like muscles. If you don't use them, they become weaker. If you don't use your health in the right ways, then you start to lose it and you don't grow. So yeah, by default, there's a direct relationship, and there's a transcendence from health into into life achievements, into goals, into life potential, and into your overall contribution and purpose on this earth. So there are so many levels to that, and people don't realize that when you are suffering with your main focus in life is dipping in and out of illness, in and out of pain, in and out of conditions, then you are, without realizing it, you are on the lower spectrum of your life potential. And that if you really want to understand the work that we do, then you'll come to the realization that this isn't about taking your fuel tank from the empty, to say, out of the red zone just above that. Okay, to say that when your body stops signaling that fill up the tank, and it starts giving you emergency messages, that's not the purpose of medicine. That's not the purpose of health. And this is what we're taught. We're taught sick care. We're taught to go and react to illnesses, and if you don't have symptoms, even now, the doctors you go and you say, okay, I've got these symptoms and so forth. Okay, well, you know what? When it becomes worse, then come to us, right? Then we'll deal with it. It's crisis management, really.
Yeah,
Okay,
yeah.
so we've got the completely wrong end of the stick, and we've been taught and we've been spoon-fed this concept since a young age, and even to this day, you know, we're being taught the same thing. Even though our knowledge, even though the research, even everything that we stand for teaches us the opposite, yet we're in a system which won't allow it. You know, you go to certain even media channels and certain things and you start speaking in a certain way, and you know
We're invited back.
yeah, exactly, you're sent back to just say, okay, well, you know, that's not part of what we're really pushing at the moment.
Yeah, no, Dr. Rizwan, I don't know if you know, so I started off life as a journalist. That was my mission, and that was my way for me to spread truth. You know, that was my alignment, and that's what I believe my greater work to be. And then through that journey, that led me to becoming a health practitioner, because actually I was burnt out in India working on a project, started to actually have Ayurvedic treatment, and I resonated very well. So very much the therapeutic side that made me start to actually think about the body and the mind connection, and actually how disconnected I actually was. So that actually started this new journey for me. So when I listen to you speak, you know, you're younger in years to me. You know, the wisdom is phenomenal, because like if I'd heard that lecture earlier on, you know, I might have, you know, anyway, everything happens as it happens. It's you know, that is the journey of life, and it's all aligned if we're waking up to the messages, and we're you know, taking note of things that are happening to us, around us, with us. So you know, when you talk about this improvement of life, I mean, I love this subject. I just want to stay here for a minute. A mindset and actually higher purpose. Actually, you know, if we're living
It becomes spiritual, you know.
Yes,
it ultimately becomes spiritual.
We are now tapping into our essence as a spiritual being. What I'd be interested in is, what are some of the key tools that you recommend when you're supporting a patient through this process?
Belief systems. Belief systems are key, okay? Because you see, we've been crippled and we've been paralyzed from a young age, because we've been taught medicine from a secular system. A system that says that you die and you turn to dust, and there is nothing that exists with you after, because there's no evidence to prove so. Okay, so what we're saying is that, you know, if you go to a medical textbook and you look at, you know, and you try and find the chapter that says soul, okay, the soul system, yeah, where is your soul system, your inner system, not the solar system, your inner soul system? Where is it? Where does it occupy? Where does it sit? There's not a word and a mention of it, because it's secular. It does not exist in their paradigm. It does not exist in their philosophy. So how can you achieve the higher levels of your being? How can you attain, you know, the level of enlightenment and the level of, you know, spiritual realization in terms of your purpose, your essence, and achieve your full capacity if you don't even believe that it exists? And the same thing goes for people on their journeys, right? There's so many aspects, you know, belief in the fact that you have the ability to heal, belief that, you know, you've been diagnosed with cancer, yet you can recover, right? Belief in that, right? The first thing you get told when you get your diagnosis is this is your your life expectation. This is the amount of time you've got to live, right? It's a definitive, it's a fact-based, scientific, you are dead, you know, 5 years time. You know, this is completely unfounded. It's not right to say that, because first of all, that, you know, they don't know the future, right? They are not the creator of your soul. They are not God, and they don't have the right or the ability to dictate that to you and close your mind off to all the possibilities. When they say to you, you suffer with, you know, an autoimmune disease, you know, this is incurable. They're not telling you about the cases of remission. They're not telling you about the thousands of people who have used natural means to cure themselves. They're telling you that you need to take these immunosuppressants, and you need to carry on taking them for the rest of your life, and they are going to cause you these side effects, and they're going to cause you those side effects. So what are they doing? They're introducing beliefs within you. They're putting your mind in shackles, right? And my job is to open those shackles. My job is to free your mind into realizing the power that you have within your own capacity, within your own understanding. And, you know, currently I'm working on a course or a program called the Foundations of Health. Okay, and what this does, it focuses on your belief systems, and it goes right back to the basic. Okay, what does health mean? Okay, what is your body? Okay, what is disease? What is symptoms? What, and these are really basic, really foundational concepts. But I've come to the realization with every single patient, these are things that once I get them to understand this during our journey, sometimes I spend, a long time working with patients. And during that journey, I come to the point to realize that there's certain people who have had this realization, and I find out, okay, well, what gets them to that point? I've tried to kind of, reverse engineer that. What is it that in my journey with them has got them to this point? And it's because they've achieved certain levels of understanding. It's not necessarily about the discipline they have with themselves and so forth, because that can be part of it. And I have some people who are extremely, high achieving athletes, are fit, they look healthy, they have, abs and biceps and all of the, everything that you would say, and they are sick. They're extremely sick. Yeah. So, discipline is not the only ingredients. Understanding, knowledge, and implementation and belief system.
And integrate, yeah, absolutely. Integrating it all into your life. This is the inner work that so many people it's certainly in the West, we find difficult to do, because actually you have to be still. You have to, reduce the impact on your senses and actually go within. And that's very difficult when we're not, like you say, we're not conditioned. It's not socially how we've been educated, and certainly how our systems prepare us for life. I mean, one of the things, in the East, I find it different. When I go and go to India, or if I'm traveling in the East, there is more focus on actually on how to live a life as well. But here we don't have those discussions. So
I think that's changing, though. I genuinely think that's changing, because I have a clinic in Bangalore, I have a clinic in South India, and I have regular contact, and I make regular visits there. And the paradigm is shifting. People are being kind of almost subdued into this notion that West is best, and the Western medical systems override. And there are monopolies that are being formed in those situations, in those countries, in those situations where you're being told to leave all of the the gold and the gems that you have in terms of your knowledge and your wisdom and your ancestral teachings, and this goes further than just health. You can even talk about agriculture and all of these different things, where now there's big companies which are coming in and they're saying, well, this is how you do things, and this is true knowledge, and they're disregarding the knowledge. Their short-term fixes can give a short-term growth in productivity, but they cause a long-term negative effect on the ecosystem, which completely deprives it and ruins it from the core. So these short-term quick fix systems of which are being introduced as superior, in the long run are actually degrading and degenerating ecosystems, civilizations, and village systems, and human health on so many levels. And this is something that we need to fight for the truth. We need to stand our ground, and we need to speak up with what we know. There's only a handful of people, I believe, that are within the country that are number one, aware and are woke in this area of understanding, and then secondly are active in their mission, and fueled with that, and are not, and there are some great people even in this country, and they've used all their fuel, and they're coming towards the end of their time in the profession, in the field. Some of them are retiring, and those gems, they're slipping out of our hands.
Yeah, we need new voices. No, otherwise that's it. Of course we need new voices. We need new energy. This isn't something that can stop. In order to awaken and enlighten people, we need that energy and that life force, behind these movements. We've got a few more minutes. I'm conscious of time. I just wondered, could you share some particular incidences of working with your specific expertise that really stand out? I think that would be really interesting for the listeners and the viewers.
Oh, where do we start? You mean individual cases, or how do you mean?
Individual cases, just a couple. Yeah, a couple where you're very proud of, and your the achievement, working with the expertise.
Yeah. Where do I start? I think we can even we can look at athletes again, I've worked with certain athletes who have understood themselves towards the end of their careers. They've understood themselves as having, injuries, and they've been shackled by concepts within their mind and ideas which have sometimes been introduced by other people, or they've, had doubts within themselves, and how we've unlocked those and have helped people revive their careers, their sporting careers, and actually make bigger comebacks than what they previously achieved before. I think there's some examples there, and then I'm working with people who have suffered with chronic illness and long-term problems, where they've been going back and forth, they've been around the block, they've been everywhere, and they've never been stopped. And this is where I'm dumbfounded, is that these cases shouldn't be amazing cases. They shouldn't be, oh, this was an amazing breakthrough case. They shouldn't be, because this is the everyday normal basic knowledge and understanding that we human beings deserve to understand, and we deserve to have access to this knowledge. Is that, look, let's stop and let's try and understand why your body's behaving in this way. Let's understand why all of these systems are why is your digestion off? Why is your sleep patterns not working? Why are you having an autoimmune condition? Why are you chronically fatigued? Why are you in this situation? Let's try and defragment this. Let's try and break this down and understand this. And when we do that, the power of that is phenomenal. Because when people realize that, hang on a sec, the keys to the cause of my problem is within my control, and the key to my recovery is within my control, then things start to change. And this is where, even now, especially during this time, I normally do run sessions where I provide health coaching, where we, just like this, we use video calls, and I consult patients from all over the world, and we discuss their challenges and their health issues, and I work with them as an advisor, as a coach on their health, to help them understand what's going on with their health, so that they can utilize the various tools and procedures and the various techniques to help themselves recover. But they can first and foremost gain a wider understanding of their overall health, and really piece together and understand why it is that the body that they have is behaving in this way, and why there's a disconnect between what they are trying to achieve with themselves and what their body is trying to achieve. I would say it's like a horse that's being ridden by a rider. If you're working in unison with your horse, you have a good relationship, you provide it what it needs, it can give you what it needs, and you have a great relationship. If you are being bucked off your horse and your horse is freaked out, or your horse has lost trust with you, or you really need to work on rekindling that relationship and restarting things from the ground, then you need to understand that you can't just go on and just imagine that there's no such thing as a horse and wonder why you keep falling on the floor. You need to acknowledge and give it the respect that it deserves. And there's so many cases in that line, whether it be dealing with patients who have infertility, to all these different things, because they all manifest en route to the overall dysfunction of the dysbiosis of the human being as a whole. And gaining that understanding is really crucial. And seeing those cases and being connected with people who have been on those journeys has really, really been inspirational. And it's really the fuel that gives me the push and the power to move forward, because I realize that every person who I come across who has those sorts of illnesses has the potential to achieve the same results as what I've seen with others.
And listening to you, everybody's wellbeing journey is different. Everyone's journey to greater health is different. And what's wonderful about your work is the approach is completely individualized. It's completely looking at somebody in that unique way. So just to sum up, Dr. Rizwan, so you are seeing patients at the moment during lockdown. So if you can tell us a little bit about that, and then how can people contact you?
Okay, so primarily I'm seeing people in terms of health consultations via our online portal. Okay, so you can have a look at that and find out more about our online consultations and the services we offer there via our website, which is icat.co.uk, which is icaht.co.uk. We have a mailing list as well, where we talk about some of the concepts which I've discussed, the foundations of health and the basic things that I think every human being should understand. Your children, your grandparents, everyone should know this stuff. It's really the basics and the foundations. So, you'd be more than, welcome to sign up to that and start having a look at that. In terms of our physical services, we are limiting them to lower risk patients as opposed to high risk patients, and we're operating those at present just once a week, but very shortly that will expand, and we're going to widen that scope to operating back in full force. And for those who sign up to our mailing list as well, we often will provide updates in relation to the courses that we offer, and the course that I've just mentioned in terms of the foundations of health. That's something which we're going to be launching quite soon. So yeah, you're more than welcome to access that, have a look at that, and to benefit from it.
Great, thank you. Well, thank you so much for spending some time with us today. And so guys, I will, once I put the video up, I'll also make it clear how you can get in touch with Dr. Rizwan. Any questions about today's video, please email them over, info@tri-dosha.co.uk, and we'll make sure that gets passed on. Okay.